Well, for many women, being a mom is a lifelong dream, but for some, it's really hard to do. Infertility impacts thousands of soon-to-be moms every year. Well, joining us now to talk more about this is OBGYN Dr. Beth Carewe about National Infertility Awareness Week. Dr. Carewe, thank you so much for being with us.
Of course, thanks for having me.
We were just sitting here talking before you came up on us that just how important it is to talk about infertility and to make sure that it's not a secret and people don't not share what they're going through.
Yeah, I think there's so much shame and guilt around infertility, and it's just so important to talk about it and have it out there so people who are struggling with it can seek help, and people who've been through it can be that support for others.
Kind of why this is such an important week, right?
Of course, yeah.
It's so important. In fact, so many millions of people. Let's talk a little bit about infertility, and a lot of people think, are there common signs or symptoms or things that people can look for? I mean, you always kind of hear if you can't get pregnant within X amount of days, that must mean you're infertile, but not necessarily the truth there either.
Yeah, I mean, so the definition, if you look at the textbook, is, people who aren't able to conceive within 1 year of trying. But for other people, if you're older, so over the age of 35 or over the age of 40, sometimes 6 months or, even less time can be a little bit of an alert to seek help and to get some more information and some more workup done to try and figure out what's going on.
Mm-hmm. For someone that's going through this right now, what are the best routes for their journey? What should be the first step and the first stop that they take?
Well, I'm biased, but I always feel like coming to see your OBGYN can be a really great start. There's a lot of things that can be done, even just in the office of the person you see for your routine exams, in terms of lab workup and just trying to find out a little bit more about where the areas of struggle are, and then, from there, trying to figure out if there are additional resources that need to be looked into.
Just being able to talk about it with your doctor, with your OBGYN, your patients, how do they feel knowing that they have somebody to walk through this with them?
Oh, I think it's huge. I think it's so important just to have that understanding, and I think to kind of lift the veil that you are not alone, that this is something that, I talk about every day, that other OBGYNs in the community talk about every day, and that there are things that we can do to help. I think a lot of us think about, oh my gosh, I'm going to have this really expensive or really invasive procedure, but there's even some simple things that we can do. And yes, we have incredible, scientific advances, and we do have a lot of access to those things here in the Denver community. There are simple things that we can do as well.
First steps first, right?
Exactly, yes.
Dr. Carewe, thank you so much for being with us and shining some light on this. And you can watch all of our health interviews right now on CBSColorado.com. Mac.
Karen, we have a lot more coming up. First at 4, constant weather.